I find that most people enjoy learning about how their bodies work. However, if you wish to skip this part and get right to the stretches, please feel free to do so. So, many of the folks that come to see me in my clinic due to pain from trying to overcome a sedate lifestyle with vigorous cycling, they suffer from a neurological phenomenon. It is actually a recalibration of the dynamic ranges of motion of the muscles involved with flexion and extension of the spine. Let me show you what I mean. You know how like when you carry a bag of heavy groceries for a while, say 10 or 20 minutes, with your arm bent at a 90-degree angle, and then you set it down? Oftentimes you feel like you just can't straighten it out afterwards, right? And that's called temporary sensory motor amnesia. Your cerebellum and brainstem have temporarily recalibrated the dynamic range of motion for the muscles that had the load on them. It is temporary, so it's no big deal. If you do nothing, you'll get full range of motion back in a minute or so. But if you take that load and you carry it not for a few minutes, but for an hour or more every day, or for several days of the week, the sensory motor amnesia can become a default setting and no longer temporary. A neurological habit that when ingrained can only be overcome with effort to restore full function. Now let's take that concept and apply it to the deep muscles of the abdomen, specifically the psoas muscles, which when contracted on one side raise the thigh. When contracted on both sides, they're the strongest trunk flexor in the body. When we're cycling, we're using the psoas in a shortened position. And it can be a long time, it can be a very intense workout. Then we get off our bike and we feel like this. Low back muscles are tight. It feels like the low back is weak, but what's really going on is the psoas muscles aren't letting go. They're not releasing contraction and they're overpowering the spinal muscles. The same thing can happen when we're driving for a long period of time. We tend to work the right pedal a lot in a seated position. The psoas is shortened. And when we get up, the dynamic range of motion has been recalibrated and you get out of the car and you kind of feel like, ugh. Does that seem familiar? Because I've definitely felt that before. The way to avoid this pain is to listen to your flywheel instructors and take the time after class to stretch your core muscles so they are balanced and your trunk can perform in its normal range of motion again. Coming next, the standing psoas stretch.